welcome to the Rule Breaker Studio. We're so excited to have Dr. Megan Carter here with us today, talking about her and all the things that she's involved in and loving these days. So, with that being said, Megan, I will let you jump in, tell us a little bit about yourself, and then let's walk this conversation.
Yeah, thank you. I'm so excited to be here. So my very brief background is nurse by background, critical care, progressive care. Did the whole leadership track, manager, director, exec. Survived the pandemic with two amazing teams, two different hospitals, and then decided in August of 23 to take a sabbatical to heal a little bit from 17 years of healthcare leadership, and then decided in January of last year, so we're actually at the 1 year mark, to start my own consulting company where I focus on supporting leaders and frontline nurses and help free up time for them to focus on what matters most, which is their patients. We clear the leaders' calendars, streamline meetings for them, and just help them go get out of survival mode. So I'm loving that full time now.
Okay, so one thing that I heard you say that I think is kind of I don't know if it's a taboo subject or how we're going to approach it, but the sabbatical, right? Like we always think about our staff. I think as leaders, we always think about our staff and the people that we're serving, and we don't think about how all of those things inadvertently affect us, especially the trying time that we've been up against in the last few years. So I just would love to hear your take on like how you got there, how you made that decision, and just kind of I know you alluded to like that now you're in your entrepreneur journey, but I'd love to hear kind of where that's taken you and how you came to those conclusions.
Yeah. So it was not a quick overnight decision. It was actually, I was planning on taking a break for a while, but I wanted to make sure that we got all the way through the pandemic. I didn't feel good about leaving my team until I felt like we'd settled. I had hired a new director and had mentored and supported her to onboard her, and then made that decision that I just, between my physical health and my mental and emotional health, and for the sake of my family, I needed some time off to just heal and be able to recover. I'd been in school almost full time for 6 years in a row. I mean, I just didn't know what healthy and balanced looked like anymore. So I planned it out, gave notice, worked through it with my CNO and the team, and took that sabbatical with no plans whatsoever on what I was going to do once it was over. So I actually, when I left the traditional hospital leadership role, I did not realize I was going to end up starting my own company. So that happened after the sabbatical was over.
Yeah. And so what made it turn into what it is? Because you talk a lot about giving them their time back, and how did you land on that as your focus?
Yeah, so I realized that some of my favorite moments in my leadership journey was when I could really meaningfully help other leaders, new leaders, or those frontline staff, those nurses. I had done some human factors work and other units where I was the leader, where we used time motion to give those nurses back more time at the bedside. It was so transformational. And just through the, the day-to-day operations and hospital leadership, you're running from one meeting to the next. You're trying to be in 3 places at once. And I, over the years, built these tools and systems in my own practice that allowed me to streamline my calendar, my meetings. I started running them way more effectively. Even the crankier physicians in my group actually wanted to come to my meetings. They actually enjoyed it because they knew they could get in, get out, drive outcomes. So as I was reflecting on how can I help the healthcare world and nurses, what did I do well? What did I get the most joy from? And it was doing those things because it's hard work. It's exhausting. And so just like you guys, if we can do anything to help them in any way to make their lives easier, to me, that's worthy work.
Okay, so I love the revelation, right? I think all of us are looking to figure out like how do we fuse joy with healthcare, right? Because it is a fine line.
Yeah.
The work, we want it to be joyous, but it's also very taxing, which I think you've really married very well in this conversation about like you have to know where you are and figuring out like where you need to go and choosing yourself. And I mentioned that because like I'm kind of in the same boat, and I think it's oftentimes that we feel like, oh, we're being selfish, we're going to make these decisions, how's it going to affect everybody else? But really, you can do nothing for anyone else if you cannot Fix the things that are going on with yourself, whether physical, mental, emotional, like it doesn't matter. You really just can't pour out anything if you don't have anything in you to give. So I think it's just, it's inspirational to hear you share, like you're at a high level executive role and you're just going to take this pivot and the courage and the strength to really be able to evaluate what that looks like and how you make those changes and how you build those partnerships. And I think you really walked well. The one thing that I wanted to call out from my little rant there is you do have to plan it, right? Like you can realize that these things are happening and you don't have to let it be just like an abrupt transition for you, for your organization or your family, but you can make those transitions and you can make them happen effectively and make them work for you, so that you do have that time to figure it out. So I think it's really, it's really inspirational. We've talked to a few leaders who've had those kinds of situations, and it's nice to hear people at that level taking the opportunity to reframe what the narrative looks like for them.
Yeah, I love that. That's awesome.
Kudos to you.
Oh, thank you.
Yes. Well, I'm super intrigued because I still can't manage my time. And I teach time management hacks in leadership development all the time.
Yeah.
And those wasteful meetings are crazy. I think my favorite resource for that I know of right now is, I think I've shared with you before, Priya Parker, The Art of Gathering.
Yeah.
It's my favorite because it's genuinely, why in the world are we getting together? And is it the right people? And what's the purpose?
That's what I was going to say. Is it the right purpose? Yeah.
And why do I even belong in this meeting? Sometimes you show up and why did you invite me? I'm sure, was it just because you didn't want to hurt my feelings? You wanted me to feel included? Because don't worry about that.
Yeah.
And, there are all these tips and tricks of the ways that you can manage your notifications and when you respond to email. But if I had to say, what are the top 3 things I could do today?
I think number one, the thing that I teach my clients is at the foundation, sit down. You're going to have to accept the fact that this is going to take a little bit of time to look at, but sit down and figure out what are your priorities. Because it could be, there are 100. Everybody needs something from you. They need it right now. We work in an industry of life or death. So everything feels like a crisis.
High demand.
Yep. So sit down and get clear on what your priorities are. Is it a certain department? Is it a certain project? Is it your own physical, mental well-being? What are your priorities? And once you can get really clear on that, the next step I'll have them take is to look at their calendar. And most of these calendars, you're triple, quadruple booked every hour. And so I just try to lovingly reflect with them and I'll say, do you have clones? Are you actually showing up in 4 places at once? Of course we're not, right? Yeah. So talk to me about what's driving this. Do you feel compelled to accept all these invitations because you're afraid that you'll be the bad guy if you don't? Like what's going on in your organizational culture? Because every hospital's different. Every department's different. What happens is you walk in as a leader, as you're brand new to the organization, and you inherit all of that stuff, whether you realize it or not. And so you feel this pressure to fit in and accept the way it's always been. And we're known in nursing for doing things the way we've always done them, right? So I'll sit there and I'll go through a series of questions to challenge that. And then I help them work through those meetings with a standard tool that I've created called a calendar clearing triage flow map. And I can literally within 30 minutes help them knock out 4 to 8 hours every week. That just opens up for them. And so the next question is, what do you want to do with that time? What were your priorities again? Is it rounding? Are you going to go engage with your teams? Is it sitting in your office getting strategic instead of operational with your projects and what is it? How do you want to use that time? Be intentional. And the last piece is you tell people what you're doing and why. Because if you don't protect that time and you don't help people understand why you're doing it this way, you won't sustain it. And it's been really transformational for folks. It really helped me a great deal. We also take the meetings that are left that are truly mission critical, and I run them through my streamlining tactics, which are you have very clearly defined roles. You have ground rules for the meeting. Things that go off on the side rail go in the parking lot. Like it's just structure that sounds a little micromanagey to some people. But I'm telling you, when you put those in place, your meetings they end early. They're driving outcomes. People want to come to your meeting because they know it's going to be impactful and you're not wasting anybody's time, which is the most precious resource we all have. So I think those are the top 3 places, the priorities, the calendar, and the meetings where we can start with these leaders to help them just take a breath and try to remember why I'm here and what's most important today, this week, this month.
Yeah. Don't you find that most people, those things that they think that they have to do are self-imposed and not really from their leaders? But I do see a lot, and I'm curious if you see the same thing when I'm identifying what my priorities are. Sometimes they don't necessarily align with what my one-up thinks my priorities should be.
Yeah.
And managing that. Or when you look at the calendar and it's back to back to back to back, triple, quadruple booked.
Yep.
Never a moment to hydrate, to run to the restroom, to feed yourself.
Yep.
Like just Maslow's.
Yep.
And
We're at the
so
foundation.
helping them navigate through that. Sometimes it's a harder challenge than anything because it's like, I have to do it. Says who?
Yeah. That's one of the tips too I give at the end in my series that I've launched is the communication strategy. So this is all great for me as an individual, but I work in this complex organization. People have different relationships with their leaders. Some people can go to their leader and say, hey, this is what I'm doing and why. They're like, great, go forth and conquer. Some people don't have that. And so what we build in there are communication strategies and little mini scripts that they can fill in the blank to say, I'm clearing my calendar. Here's why. Here's how I'm going to spend my time. I want to execute on these priorities to help drive the organization forward and keep our patients safe. Are you good with that? Yeah. What leader is going to say no to that? You know, and then communicate that to your peers, because if I'm getting meeting invites from quality and risk and biomed, and so having those communication strategies in place, to your point, to fill in the gap, I'm not assuming what's expected of me. We're having these very open conversations. What are the expectations of how I spend my time? And because I can't do it all, I think that really helps people have those one-on-one conversations with their leaders. As a leader, when my managers, I encourage them to do this, when they would come to me and say, hey, I know we said I was going to focus on this rounding this week. I've been pulled into this project. How do you want to handle it? We talk about it. Takes 10 seconds. They're clear on where they need to go. I'm clear on what they're doing with their time. Easy peasy. So sometimes it's just taking a breath and having some structure around how to fill in those gaps so you're not unclear and it's not self-imposed and we're not filling in the blank with everything, right?
Yeah.
So one thing that really stood out to me that you said was you're not cloning yourself, number one. Number two, you are triple and quadruple booked, and how overwhelming that is. Like, I can just remember, I literally had a little flashback of like my first director role. And I was like, oh my God, I've got literally 4 meetings. They all overlap. I'm going to be late to everyone. I'm not going to really know what's going on. And I'm not even going to have time to communicate and find a person to fill in on my behalf or, figure out like how I get the notes, how I get the, updates, that kind of thing. So really, like, truly, also it's having that conversation and accepting those communication tips to then re-strategize with the people who are inviting you to these meetings to say, hey, what is my contribution? And do you really need me at the table? Because I have X, 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 and X, and I cannot be in all those places. But I do want to support the organization and I want to support the work where I'm needed most. So I think those communication tips and just even thinking about like just decompressing your brain from the fact of thinking that, oh my God, it's Tuesday and I got to get up and go to work and figure out these 4 or 5 meetings that are compounding of information. So I love the idea of like, if I would have had a person like you, I feel like I would have maybe even lasted a little bit longer in my role.
Same.
And not felt like the immense burnout. Because even just thinking back, like having the little flashback, it's a flashback, probably borderline.
It's triggering.
Yeah, it's very triggering. I'm like, oh my God, like how did I even survive? And then top it off with like a pregnancy, life, emotional, and then you had your overwhelming, meeting day, and you're like, oh no, I'm done, and I have to pee. No ifs, ands, or buts about it.
Right. It's basic needs.
Just hearing like those strategies, just even those tips and tricks. Gosh, I'd have been all over that.
Same. Well, and it came through trial and error. And I love what you said, Alyssa, because it comes back to group norms too. So one of the things I'll do in the workshops where I have all of the leaders together as we go through these tips and strategies, they're excited. And then how are you going to spend the time? How are we going to move forward? What are the new norms? So when you're sending me a meeting invite, tell me what is it for? Hey, Megan, I need you to attend this because I need an exec sponsor or facilitator. Or, hey, I'm just sending this to you as an FYI so that you know we're on it. You don't have to accept it. Like, be clear with each other.
Right.
We should not have to feel moral distress every day as healthcare leaders because our calendars are crazy. Our teams need us. They need to see our faces. They need our time, our energy. We need to engage with them.
And when do you actually complete any of the tasks that you got, or any of the work, or any of the research, or any of the figuring out of whatever is happening from the meeting, and how you carry it forward? How do you build the strategy if you never have any time? And I mean, like, I know you all can relate, but like, there would be some times when I had, like, I'd look back at my calendar and be like, God, I had 27 hours of meetings this week.
Correct.
Yeah.
That left me with the assumption of 13 hours to actually figure out what we talked about, synthesize it, disseminate it where it needed to go, take ownership of what I needed to take ownership of, and manage all of the day-to-day operations of an entire department or service line.
Meanwhile, there's a water main break. There's a maternal hemorrhage that needs care flight transfer.
And
I don't know, a global pandemic.
The panda hood on in the sword. You know what I mean? Like, life scenarios.
Yeah.
You know, someone's getting tased out back. Like,
exactly. Right. Can't make this stuff up.
I mean, literally. And then, and I had 13 hours to deal with that. With and I'm not saying like that's the average, but I mean, like, I literally, have a flashback to like some of those weeks where I'm like, what did I even do this week?
Right. My favorite.
I work home for the weekend. Literally. I'm gonna take my laptop home and try to get my thoughts gathered.
My favorite best practice tip that I came to it through survival, but Friday afternoons. My team knew this. Friday afternoons, I would close my door. If I could get a full hour, I'd be excited. I didn't always last that long, but I would take that hour and I would take that long to-do list that had built up all week with all those meetings. I would reorganize my, what needs to happen next week, a month, whatever. Who do I need to follow up with? I'd organize my thoughts. I'd look at my calendar for the upcoming week and get settled, knowing full well that the best laid plans can go to the side real quick, but at least I had a plan. At least I had captured all my deliverables and in my mind how I was going to tackle it in the upcoming week. The amazing thing about that I didn't intend was that I would go home and I could actually mentally unplug because I wasn't worried about what I'd forgotten or who I didn't follow up with. Like, I had dumped it all out on paper or on, you can do it on your computer, and it was there. It was waiting for me when it came back. I was not going to drop the ball, so you could actually rest.
So funny that you say that, because I used to do this thing called a brain dump, right? I'm like,
at
the end of the day or at the end of the week, whatever. Mine was like a daily, but I still, to this day, I know everyone's going to judge my like little sticky notepad.
I used
at the end of the day, I would just like, okay, everything that I need to get out of my brain, but that I don't want to forget, because I noticed, like, after that first year in an executive leadership role, I would carry it, and it continued to keep me anxious, right?
It does.
Just to the point where I was like scared to go to sleep because I was scared I was going to forget.
Yeah.
Right? I was going to forget something. So I started just like brain dumping everything. And then that way at the end of the week, I could compile like, okay, these are all the things. And now I need to get it organized and get my self situated. And I still brain dump to this day. Like, still have to brain dump because I have to have some way to like let it go.
Yeah.
So I'm curious though, is there a tool like I like Otter AI that I use, an app I put on my phone, I take it to a meeting or conversation, and then it'll kind of pull out deliverables is there a tool like that that you're using, that you're finding success with or have found success with, maybe in your roles or in your conversations with other leaders and things that they're trialing that you would recommend as a starting point? Someone who's maybe, trying to figure out how these things work for them.
Yeah. So the more basic template I use is called the 3 W's, the who, what, when. So this is intended to replace your meeting minutes. Nobody's reading those 20-page minutes. Nobody's doing it. No. So 3 W's for the deliverables. And at the bottom of that page are your bullet point key takeaways. So most of my minutes, so I had a Code Blue committee meeting that would meet every month. Our minutes used to be 8 pages long. Nobody's reading that. So we switched over to the 3 W's key takeaways. It was maybe a page, page and a half. Everybody read it because your name is the who. Your name is assigned to a deliverable with a date. So what they would do, and I'd send those out immediately after the meeting, is everybody would look for their name, what their deliverable is, and when it's due by. And what was so transformational is we'd come back to the next meeting, and guess what? We drove action because people knew. Now you can do that with AI now in the 21st century. There's lots of tools out there you can use. I will caution, there are some clients that have given me feedback on AI taking notes for them. If you're in a meeting where you're discussing patient sensitive data, which is a lot of hospital meetings, you have to be very careful about what your policies are with letting AI take those notes. Where's that data going? You need to be in close contact with your IT department to do that. That's feedback I've gotten. I personally like using Asana on my desktop and my phone to keep up with deliverables in my to-do list. But you can use any tool that works for you.
Okay, good. So I love that. I think I alluded, I use Otter sometimes just in, really even in just conversations like, hey, if we're going to talk about a project or a process or something like that, just to help, facilitate that memory bank.
Yeah.
Where did the conversation lead us? Because sometimes you're like, what did we say?
Yeah, rabbit hole. Yep.
Found something that was like gold, and now I've forgotten half of what we talked about.
Yeah.
So I found a lot of success with that one. So I appreciate you sharing that. I think those are tips that people can carry with them,
Yeah, absolutely.
I will say we did bring you on the Rule Breakers Club.
Yes.
And so I do have a rule breaker question for you. So Megan, if you are breaking any rule in healthcare, what rule are you breaking?
Yep. The rule I would break is you're not allowed to add something to your team member's plate or your leader's plate without taking something off. You cannot add without subtracting anymore, period. End of story. Because people's brains and time are finite, they're limited. And boy, we love to pile on unintentionally. I don't think it's on purpose. But the rule I would start disrupting and breaking, which I'm trying to do with this work and my clients, is don't add without subtracting.
No, I think that's such a good rule because, like you said, like that's how you end up with the 4 meetings at the second hour block and no lunch for the day is just that compounding work that you never let go of. So I love that. So I do have another question. Best and final. If someone wanted to touch base with you, get in contact, book you, schedule, understand what your services and resources are, where are they finding you?
Yeah. LinkedIn is the best social media platform. I'm on there all the time. Answer DMs. You can email me. You can call me. All my information's there. My company website is very user-friendly. You can find out about the Simplify to Amplify digital membership series to help clear up calendars. I'm doing workshops with entire groups to do that as well. So all that contact info, email, phone, LinkedIn, and company website.
Okay. And I will include all of that information in the show notes. And
Perfect.
as well, they will be able to go there and find you. So I'm so excited. Thank you so much for your time today. And it's so wonderful to welcome you to the Rule Breakers Club.
Thank you for what you do. And thanks for having me.